Hello, everyone. Uh, how are you today? Now we are here meeting once again. We want to talk about simulation of the case of the cancer cases, and we will give a medical nutrition therapy using that case. This is a real case that happened in a public hospital in Medan, Indonesia. So I will share it with you just a moment, okay? How are you today? I hope you are having fun today and have a good health. Okay, let's see. Can you see all the screen? Oh yeah. Just a moment. Slideshow. Okay, I will try to share with you about this case report, and we will see from the nutrition aspect. This case is about breast cancer, the diagnosis, breast neoplasm, and the staging is malignant. Okay, chapter 1. In chapter 1, there is a background. We all know that in this breast cancer case, need nutrition therapy. But it's not only nutrition, but also we need collaboration between professionals needed for ensure that cancer team care health efficient and capable collaborate. So in this case, that we do need collaboration. We cannot stand all by ourselves, only one. So the partnership between Power Health has a background behind the profession, different and mutually work the same for solve problem, health, and provide service. As well as we have our goal, including here is cancer therapy, medical nutrition therapy, and physical activity in cancer. Actually, in me and my colleague already discussed about this case, and also the student in the campus, and then the hospital. Okay, so we studied that breast cancer actually, this is the most common cancer diagnosed in women, and the main cause of the death based on the consequence of the cancer. The aim is the purpose of this discussion is to fulfill the aims of e-learning courses, of long life learning courses, especially about the report case. And the benefit is of this discussion is that all the participants can understand medical nutrition therapy and also physical activity, including the collaboration. But right now we focus on nutrition therapy. Okay, we come into the chapter 2, case implementation. We talk about the patient. Now we have here the patient status, Mrs. E. She is gender is female, and date of birth is 15th November 1981, and her age 41 years, 41 years 1 month. And she came to the public hospital 8 December 2022. Let's see from the anamnesis or about the history of the patient. why she came to the public hospital. I will read it for you, to all of us. The patient came to a public hospital with a complaint lump in the breast adjacent to the right breast 3 months ago. Pain at the moment not pressed found, and also patient confessed lump no could be driven and consistently solid. Redness of the area lump found, but the black stool not seen. Also defecation and urination within normal limits. Decline weight found as much as around 5 kilograms in the last 2 months, and also decline last eats not found. The patient has a habit of eating regularly, but the hypertension, history of hypertension found, however, it's not controlled. History of diabetes mellitus denied. History of using drug not found. Allergy history of food also not found. Allergy history of drug not found. A family history of the same disease was found. Her mother died with breast cancer. No regular physical activity or exercise in the last 2 months. How about patient status based on physical examination? So this patient has a vital sign, consciousness, and then he's not fever, have fever, and also frequency of the pulse around 70 times per minute, and also the blood pressure about 120 per 85 millimeters Hg, and also frequency of the breath 20 times minutes, and 99% room water. Based on anthropometry, her weight is 60 kilograms and her height is 155 centimeters, and her BMI 24.97 kilogram per meter square, and we can categorize this patient is overweight. And the circumference of the hand, upper hand, 29 centimeters. The generalized status head, we have no abnormality in the head, and also from thorax, symmetrical, fusiform, sonor. There is no significant physical diagnosis for this abnormality in the thorax and also abdomen, and then also extremities. But in localized status in mammary, from inspection there is appears mass. We cannot find retraction or abscess or blood, and the feature of pseudoram, skin dimping, and no look lump in the axilla. From the palpation, there was palpable one mass size 5 square 5 centimeters, immobile, and the consistency of heart, surface uneven, boundary no form on the breast adjacent right. So it's on the right mama. From the laboratory examination, from the hemoglobin, there is no sign of anemia, only MCV and RDV-SD. There is some lower value. And also we have here higher eosinophils from the count type of the blood. Okay. And then from the hemostasis, we can see all of this still in normal range, and this patient is prepared to do the operation in the next few days. And also from the gas analysis, we can see here it's all in normal range. So the working diagnosis is breast neoplasm, right area, suggest malignant. There is no stage 3, no metastasis, and no spread to the lymph. Okay, T3N0M0. So the pre-operation treatment, we suggest for the bed rest and also fasting 6 to 8 hours before operations, and then we give her ringer lactate infusion around 20 drips per minute, and also antibiotics injection. Okay, we move to aspect of medical nutrition therapy. So I will try to explain about the aspects of nutrition. We know that the medical nutrition therapy is the nutrition therapy which stages started from assessment, nutrition, and also nutrition diagnosis, intervention nutrition, and also counseling nutrition, and monitoring and evaluation nutrition. And this medical nutrition therapy aims to understand that the patient will get suitable food for the intake, and also with condition of her health in effort upgrade the good outcome for the patient. Medical nutrition therapy started screening targeted nutrition and for identify patients about the risk of malnutrition, or is there any special condition. Now we talk about the screening nutrition. Actually, we talked about this topic in our first topic about nutrition. So the method for the understanding nutrition problem in cancer patient, it should be the screening of nutrition. And it should be done fast, simple, efficient, easy, and process done, cheap, and no risk in screen individual. There should be a valid and reliable as well as could carried out. And the aim of the screening nutrition is to identification at the patient's malnutrition risk, or there is no risk of malnutrition, or some special condition, as well as predict possibility more results, good or more bad because of factor of nutrition, and what medical nutrition therapy should be given. Okay, we conducted screening nutrition to the patient at the first 24 to 48 hours after enter the hospital, and it should be done actually periodically. And we use the instruments is malnutrition screening tools, MST. Actually, there are many of the MST or the screening for the nutrition for the cancer patient. But in this case, we will use the malnutrition screening tools. And the advantage of MST is it can be used in time, a short time, simple question, high sensitivity and specificity, and not depend on the anthropometry and laboratory result. We will see the result from the screening. It will be 3. First, the patient no malnutrition risk. and it is necessary screening repeated every week during hospitalization or moment visit repeat when take care on the after he uh, out from the hospital. And then patient malnutrition risks, it's continue with nutrition assessment, and it should be a nutrition diagnosed, and we should give her therapy nutrition. Or patient in condition malnutrition, so it already have a stage, we decided that this patient is malnutrition and it needs some uh, nutrition diagnosis and medical nutrition therapy. Malnutrition screening tools, it has some not much question for this. The first is, has the patient lost weight recently without trying? And this within in the last 6 months. And then yes, actually it should be 1, no, 0, unsure, 2. And the second, if yes, much weight has the patient lost, it should be around 1, 2, 3, 4. And there is some, the highest is more than 15 kilograms. If there is 15 kilograms, so we categorize it with 4. And then the second question is, has the patient been eating poorly because of decreased appetite? If the patient answer yes, it should be 1. And the parameter of decreased appetite is less than 3 per 4 usual intake. Or may also be eating poorly due to chewing and swallowing difficulty. So these two questions, we will ask to the patient. For the question number 1 here, if unsure, ask if they suspect they've lost weight. For example, the clothes loser. Okay, so we can give the score is 2. Now, after we ask this question and we can decide it, if the score less than 2, not at risk of malnutrition, we categorize that. But it is more than 2, including score of 2, we categorize it at risk of malnutrition. Okay. As we explained before, that this is the anthropometric screening result. We can see that this BMI, body mass index of this patient, it is categorized to overweight. And then to this patient, based on the malnutrition screening result, is the patient that happen to decline of the weight in the last 6 months? And the answer is yes. Yeah, the patient confess experience decline body weight around 5 kilograms in 2 months. So the score is 1. Okay. Now, is it the food reduced because the loss of it? This patient still eat like the usual, so we pointed that this patient have a score 0. So we conclude that this patient no risk malnutrition, but it needs repeated screening each week during hospitalization or at the moment visit repeat treatment. Okay, so we move to other history. This patient often consume 1 portion of meatballs and noodles It's around 3 times a week. So the problem here actually in Indonesia, there's a kind of food with many soup and meatballs and also noodles. If we have the meatballs and noodles based on home-based food, actually there is no problem with that. But most of the patient or people often consume uh, on the outside, restaurant outside, most of them using some additive, to increase our appetite. So they probably this patient really love to eat that meatballs and noodles. And then patient also like to consume higher frequency of fried food and fried broiler chicken. Based our last meeting, uh, we already discussed that people who always have dietary habits like eating fried or high calorie food, most of them related to the obesity, and the obesity related to the cancer, increased cancer incidence. Unfortunately, in this patient, she confessed that she very seldom to consume vegetable and fruits. These vegetable and fruits have actually have a positive action to the patient with the cancer problem. It most of them just like prevention of the cancer incident. But this patient, in this case, truly showed that she really have a less vegetable and fruit intake. Okay, we can see these four aspects here. Okay, from the related nutrition and food, it seems that there is no problem. Also in the physical data, clinical related nutrition, anthropometric, she categorized in overweight, almost obese, more than 25 kilogram per meter square. It in categories to obese. And this history of data of the client about past medical history or history of drug use, there is no sign. There is no negative impact. So this is what she ate. Okay, it seems that she had lunch, dinner, and breakfast, and most of them very less of the vegetables. And then we can see here around 1,000 calories. And then we can see here it's the fat intake has more than usual. Actually, the proportion of the fat is around 20 to 25%, but this is more than 36% of the fat. The nutrition diagnosis, we can separate it in 3 domains. The problem is how about the intake, okay? And the actual problems related to intake of energy, nutrients, fluids, bioactive substance through oral diet or nutrition support. And then the clinical nutrition, the nutritional finding problems identified that related to medical or physical condition and also behavioral or environment. It's include here is nutritional findings, problems identified that related to knowledge, attitudes, beliefs, physical environment, access to food, or food safety. So, based on our case, this intake domains, there is actual nutrition problems related to intake of energy, nutrients, fluid or bioactive substance administered orally or with nutrition support, enteral or parenteral. And the clinical problem-related nutrition with condition, medical or physical, and also behavioral, with various nutrition-related problems with knowledge, attitude, and beliefs, environment, physical access to food, drinking water, or supply food and security food. Okay, this is the same about this, that we see that not enough intake energy on the patient related with no balanced intake consumption patient be marked with no in accordance received calories, and also patient with calories needed through calculation total energy total daily energy expenditure. And also based on the clinical, there is a decline everybody patient related with illness. Patient have breast neoplasm suggestion malignant and marked with exist lump or breast right patient accompanied painful breast. Based on the behavioral, habit eating meatballs, Indomie, I mean the instant noodle, no, not like eating vegetable in the or fruits related of knowledge less patient, and about nutrition be marked with food recall result found too high consumption, too high, so high the consumption of fat on this patient. Okay, the intervention of the nutrition. So based on our calculation, based on our last meeting, we have 1,170.5 calorie per day. And also if we add some activity daily patient and also stress factor, actually he needs 3,200 calorie per day. But we can start it because he already in overweight categorized of the body weight. We can start low intake based on the daily intake and we increase gradually. Okay, how about the macronutrient of the patient? So macronutrient of the patient is, you see at the moment here, that patient currently preparation in high protein because of he is going to have some operation. So we can see this is a high protein diet has a rule replacement damaged tissue regeneration process. We need a new cell, so we need some more higher protein. We can have a low diet fat. Low diet fat is around 10 to 20%. So we have here around 19 or 38 grams fat per day. We all know that 1 gram of protein equal to 4 calories and also 1 gram of fat equal to 9 calories. How about the carbohydrate? The carbohydrate, we can give the patient around 20 to 40%. So it is around 160 or 320. We can reach these needs. We have to calculate. We can see that one portion of the rice could be 150 grams. So we have to calculate this so it can reach the patient need. From food intake. So this patient has no problem with chewing, swallowing. So from the gastrointestinal tract, there is a normal condition. So this patient will eat normally. Not found disturbance swallowing, disorder in digestion, fever, age factor. So suggestion no needed special food form changing, such as soft or liquid food. We move to micronutrient and antioxidant. So we can have here the beta carotene, vitamin E, vitamin D, the vitamin C, and most of them mineral. So we can choose a lot of multivitamins, including this. Why? Because the mode of action, of course, antioxidant will catch or scavenge the free radical. In this case, this patient is have a cancer and probably there is a higher uh, free radical will come out from the cells. And also antioxidants have a function like immunomodulation and inhibit mutagenesis and inhibit carcinogenesis. We can also suggest the patient, besides she ate a lot of fruit and vegetable, we can try to choose green tea or more other fruits that really have very bright colors. Intervention of nutrition. So we can have here, we have to educate the patient and counseling. It's how she has to reduce food fatty and also salt, and also increase vegetable and fruit index, reduce food process intake because it is we know that it can be a reason for higher cancer incident of the cancer, and recommended for consuming food high in protein. It's to prepare operation preparation. So we suggest this is the menu of the patient. This is the food, the name of the food, and also this is the ingredient of the food. Okay, breakfast, morning snack, lunch, afternoon snack, and by the end of the day, she will have some dinner. Not much, but I think it's enough to have some good composition based on the protein, carbohydrate, and also fat. We can do some monitoring and evaluation. Uh, we can choose per 3 days to see the progress, monitoring and evaluation nutrition, and also monitoring results of the laboratory, and also monitor intake nutrition, including here pre-operative preparation. And also for the evaluation, there is found food intake that is not adequate, high in fat and sodium, and we should check repeat results laboratory for 3 days. And also we conclude around 1,720 calories, but by the end of the therapy, she will reach for the 3,000 because this patient really needs the support of the energy. Conclusion. Okay, we arrive for the conclusion that patient E, Mrs. E, age 41 years, came to the public hospital with complaint to the lump in the breast on the right since 3 months ago. Decline weight found as much as 5 kilograms in these 2 months. And this patient was diagnosed with the right breast neoplasm, suggested malignant. And this clinical staging is T3 and 0M0. And given bed rest, fasting 6 to 8 hours before surgery. For the medical nutrition therapy, we will give this patient is high calorie intake, starts with basal metabolic rate intake, very low, and then we studied and around 3 days and monitor evaluation, and then the next 3 days. So it increased gradually based on monitoring and evaluation. And also please check for the macronutrient composition because this patient is going to do the operation. So I think we have to provide some higher protein in the situation to have the next healing or wound healing is much better because of the protein status in the body is very stable. Okay, we are here by the end of our discussion. So if you have questions, you can contact me by email or any other by WhatsApp or anything. Or you can write a question in the Moodle, so I can check it and I will answer that. Okay, thank you very much, everyone. Bye bye. Bye bye. I will stop share. Assalamualaikum.